Hey Shiva, how are you doing?
Hi, Nicole. I'm doing great. I am so happy to be here today with you and with our very special guest, Dr. Carla Kuon, today.
I am so excited as well. We had Dr. Kwan on episode 13 that was published in July of 2022. And in that episode, she talked about food in medicine. And we are excited today to discuss a new topic, long COVID and chronic fatigue in medicine today.
Yeah. Nicole, I have some friends who are nurses who have gotten COVID early on in the pandemic in 2020. And, COVID is all new to all of us, so we didn't know what to expect. But two of my friends who were frontline workers in the heat of COVID unfortunately got exposed, got quite sick, and have one of them for a year later still has symptoms of brain fog, fatigue, muscle aches, a lot of different sort of vague symptoms. It's become clear that this is probably long COVID. She's actually had to go on disability and hasn't been able to return to work as a nurse. And she was an exceptional ICU nurse, really bright. And she's still really bright, but she's really having a hard time with suffering through the symptoms. So it's really very real. And unfortunately, because it's so new, it's been very hard for her to get diagnosed, and even more than that, hard for her to know what to do to get treated. So I'm really happy to be talking to Dr. Kwan today because um, I didn't know that there are some things that could be really helpful for people with long COVID, and I'm learning that from her. And I did get her book also, which I'm excited for us to talk about, and it's amazing and just such a great resource for people who have either who are in medicine or honestly it's a well-written book for anyone to be able to access the resources and the understanding of what this is and what to ask for from your doctor in terms of getting tested and diagnosed and treated and get help. So it's really very personal for me. And I know there are many more people. We can talk about some of the data. How about you, Nicole? Do you know anyone or have you had any experiences in your own with long COVID so far?
Yeah, long COVID is definitely one of those conditions you hear about. I thankfully, nobody in my immediate family friend group has experienced long COVID. But personally, when I was in middle school, I unfortunately, after contracting mono or EBV virus, ended up having chronic fatigue syndrome for about 6 months after. And it's definitely one of those things where, you're in middle school and you usually, are going through a lot of sports, you're trying to do well in school. And it really was something where I was unable to get to school in the morning. I'd get dropped off late or I'd have to get picked up early. And it really affected me being able to do my normal day to day activities. And we tried kind of all the traditional things, went to the doctor, and unfortunately, nothing in traditional medicine really helped until I went and saw an acupuncturist. And having acupuncture really turned the corner for me, and I was able to get past that chronic fatigue syndrome. But just having experienced it once, I definitely have a lot of sympathy for those who are experiencing long COVID because I think the symptoms are even potentially more severe for some folks and are causing severe disability and an inability to be able to work, which definitely can affect everyone's finances and day to day living. And so I'm so excited today to introduce Dr. Kwan back to the podcast. Dr. Kwan is a integrative medicine doctor and hospitalist who is the director of the massage service at UCSF's inpatient bone marrow transplant service and will soon become a co-director of UCSF's COVID Optimal Clinic along with Dr. Lakshmi Santosh. Sorry.
Santosh.
Thank you. Along with Dr. Leshmi Santosh, she has a particular interest in integrative oncology, nutrition, precision medicine, mind body medicine, and traditional Chinese medicine. Dr. Kwan will be discussing long COVID, chronic fatigue syndrome, and her new book, The Long COVID Solution, a holistic integrative approach to post viral recovery. Welcome, Dr. Kwan.
Thank you so much, Nicole and Shiva, for having me again. It's great to be here.
Thank you so much for being here again, Dr. Kwan. We always love having you, and you explain things so clearly for us to learn. And so we really are looking forward to talking with you about long COVID and the recovery from it. But before we get started, we always ask our guests, and we asked you this last time, could you, in short, share a meaningful moment from some time early in your life or early in your training that was particularly formative or a defining experience?
Yeah, so you know a little bit about me from the last podcast, and you know that I was diagnosed with celiac disease at the end of my residency training in Boston. And more relative to what this episode is about, I had to take a 6 month sabbatical before accepting my first job after residency because I had chronic fatigue syndrome. And I remember thinking, oh, I'll just take a 3 month sabbatical and I'll sleep as much as I need to recover, and then I'll be fine. And then by the third month, I was still sleeping 18 to 20 hours a day. And I started getting worried and I thought, am I ever going to be normal? And when I took my first job, I was a nocturnist initially because at night, there were less, there was a little less active, a little slower. And my brain could tolerate the workload because there were less interruptions. I was still healing. My brain was still healing from that. And I remember all I did was sleep after working. And so, as someone who knows how devastating chronic fatigue syndrome is, I have so much sympathy for people who are going through both CFS and long COVID right now. My heart really goes out to them. Mm-hmm. The good news is there's a way out. You don't have to be this way forever.
Thank you so much for sharing that. We really appreciate you sharing your personal story.
Mm-hmm.
And to get us started, we should note that March 11th, 2023 marks 3 years since the WHO declared COVID-19 to be a pandemic. According to a recent article in The Lancet in March 2023 called Long COVID 3 Years In, on a global scale, long COVID has not received the attention it deserves, and there is a general lack of public awareness. While the world is determined to move on from the acute phase of COVID, at least 65 million people worldwide are estimated to struggle with long COVID, a debilitating post-infection multi-system condition that with common symptoms of fatigue, shortness of breath, cognitive dysfunction, impairing their ability to perform daily activities for several months or even years. And although the majority of patients infected with COVID-19 recover within a few weeks, long COVID is estimated to occur in 10 to 20% of people with COVID and affects people of all ages, including children, with the most cases occurring in people that actually just contracted a mild acute illness of COVID-19. These consequences are widespread and are causing global harm to people's health, well being, and livelihoods. An estimated 1 in 10 people who develop long COVID stop working, resulting in extensive economic losses. And that's not even counting how much personal suffering is going on behind the scenes because of this condition. Dr. Kuon, can you start us off by talking about what long COVID is and what are the symptoms and how do we diagnose it?
Yes. So long COVID is described as a syndrome of persistent symptoms about, depending on the CDC criteria, lists 4 weeks after a negative COVID test or after recovery from COVID. The WHO criteria lists persistence of symptoms 3 months after a negative COVID test or recovery, full recovery. And the symptoms are various, but the three most symptoms, according to a very nice Davis et al. Article from 2020, are fatigue, that's the most common symptom, post exertional malaise or exercise intolerance, brain fog, and cognitive symptoms. Those are by far the most common. And cognitive symptoms can be everything from memory loss, lack of attention span, insomnia, and other things that are common are muscle aches, language issues like not being able to remember a word. And then other common issues include shortness of breath, chest pain, joint pain, muscle aches, tightness of the chest, and tachycardia. Now, one of the difficulties in the diagnosis is the CDC and the WHO criteria are different. And that's a little bit of a challenge for diagnosing long COVID. But I do favor the CDC criteria because these symptoms, when addressed early, can actually resolve faster. And so I favor a earlier diagnosis so people can get the help that they need and get on their track to recovery faster.
Earlier meaning, as you said, Dr. Kwan, I just want to make sure for all of our listeners and make sure I got it right. Earlier meaning, if you have symptoms that are persisting 4 weeks after your initial, that's when you should start thinking you have long COVID, as opposed to, that was the CDC, as opposed to WHO, which I think you said 3 months, wait 3 months. And if you're not better, then start looking for a diagnosis, calling it long COVID, is right. And the reason is because there are some interventions that you'll talk about again with us in a few minutes, but there are some interventions that you can get started on and hopefully, right, resolve your symptoms in a quicker way rather than having to suffer another extra 2 months.
Exactly. If you have COVID and you recovered from COVID and you have a negative COVID test, but it's been 4 weeks and you are still having fatigue, tachycardia, exercise intolerance, shortness of breath, I recommend that you seek care and get help for long COVID. Absolutely. In
Exactly.
my experience, the sooner somebody gets started on a protocol for recovery, the faster the recovery is. By the time I see people, a lot of times they were not diagnosed with long COVID. And when they were referred and then they waited another 6 months to get into my practice. And by the time I see them, it's been a year, two, a year and a half. And it does take longer to turn around all of the symptoms when the body's sort of acclimated to, okay, this is how it is now. It's a little bit harder to turn that. It takes longer and it's still possible to do so. But earlier diagnosis gets people better faster.
Right. And a lot of suffering in between, right? Between even before the recovery starts. So that's
It,
good for everyone to hear that.
exactly. And then all of the disability that happens.
Mm-hmm. And we're going to talk to you. We're going to sort of work up to finding out what are the things that we can do we can offer or ask our doctors to help us with to get better. But before we get into that, could you talk to us a little bit about how you got interested in long COVID in the first place, and also why did you decide to write a book, which is an excellent book. I have it right over here, by the way. So tell us about how you got started, how it got to be of interest to you, and how the book came to be.
Yeah, thank you so much for that question. So, I work at the Osher Center for Integrative Medicine, and we serve as a referral center for all things mysterious and poorly understood, including chronic fatigue syndrome. So, long before the COVID pandemic happened, I was already trying to figure out how to help patients with chronic fatigue syndrome and finding the commonalities and the things that were universally helpful to these patients. And so by the time COVID happened, I already knew that I was probably going to be starting to get referrals for long COVID, and it did happen. And fortunately, there are a lot of similarities between chronic fatigue syndrome and long COVID. So I had a leg up, I think, compared to other physicians on how to start treating long COVID. And as we started learning a little bit about the biology of the disease, and I started reading up a little bit about what it does in terms of ramping up inflammation and mast cell activation, I fine tuned protocols that I had already found helpful for chronic fatigue patients and started applying them to long haulers. And once I found a protocol that pretty much helped everyone, I thought, you know, people need to have their hands on this. They need to have access to this. Also, because, like I said earlier, intervention is helpful. People can't wait until they get referred to an integrative medicine doctor. Not everybody has access to an integrative medicine doctor. And so I thought, this is so common. There are so many people suffering. How can I get that information out there?
Well, we definitely appreciate you sharing your thoughts, your research, and allowing other people to get the information that I think this is definitely a condition not many people know about, and we're still learning more and more about it. So I think it's definitely important to spread the word and spread the specialization that you have. Um, who is at most at risk for contracting long COVID?
Yeah, so definitely risk factors are any baseline chronic inflammatory condition. And that can include diabetes, it can include obesity, it can include heart disease, it can include pulmonary conditions like asthma or pulmonary fibrosis, but also pre-existing autoimmune illness. So I knew with my health that I was at risk for long COVID, and I was very good about sheltering in place for 2 years and getting my vaccines. However, the interesting thing about long COVID is completely healthy people, young people with no existing pre-existing conditions can get it too. And we know that vaccination is protective, but it's not 100% protective. And so even people who are vaccinated can get it. And so it's a really, the one other very important risk factor is recurrent exposure to COVID. And so even though we all hopefully have several shots under our arms and some immunity against COVID, I think people are starting to relax and forget to wear masks, indoors. And I think it does speak to continuing to be observant of good prophylactic measures of masking when indoors for a long period of time, generally avoiding very crowded indoor spaces, because it can happen even if you have been vaccinated and even if you don't have chronic, just the recurrent exposure to COVID can be a risk factor for getting long COVID.
And in fact, I was thinking about how many times I've heard Bob Wachter as a leader in medicine throughout the COVID pandemic, and he's been such a help to the public, I think, by tweeting and sharing updates that we need to know that are important. And one of the things that I have heard him say repeatedly is, at this point of the pandemic, he's not so concerned about getting COVID. The symptoms are probably going to be mild, and very few people, I should say, not nobody, but he's not concerned about dying from it. His concern is greatest about getting long COVID. So if you can avoid COVID, you could, of course, avoid long COVID, and the disability and the suffering that comes from that. So again, appreciating that you're talking about what sets up people to be at risk. Understanding the biology of long COVID is also important for us to get. And I know that inflammation is a big factor. Could you talk a little bit more, just in a general sense, about what the biology is that you understand long COVID to be about?
Yes, thank you, Shiva. And I agree with what you said and what Bob Wachter said. I like to say the best way to not get long COVID is to avoid getting COVID in the first place.
Mm-hmm. Mm-hmm. Right.
So the biology of long COVID is similar in my experience to that of chronic fatigue syndrome, with one exception that I'll talk about. But I talk about in fatigue syndrome about the four buckets that contribute to fatigue. And bucket number one is a really big bucket, and it is inflammation with a big I. And inflammation has five causes. But let me talk about the three other buckets first. So, bucket number one is inflammation, and it has five causes. Bucket number two is toxin overload, and that's another big contributor to fatigue symptoms in both CFS and in long COVID. Then there are nutrient deficits. We know that, for example, there's evidence that vitamin D deficiency can contribute to both more severe COVID as well as getting long COVID. And then there is neuro inflammation, and inflammation of the brain can cause a lot of the cognitive deficits that we see in both CFS and long COVID. But it also feeds back into that inflammation with a big I. And neuroinflammation can cause a lot of the stress and anxiety that we see, the insomnia that we see in people who have long COVID. And then we have this looped mechanism where all of these things are feeding back into that inflammatory loop. And it creates a self sustaining sort of pathway in the body that can be very difficult to break unless you address all four buckets. Now, when we talk about inflammation with a big I, inflammation isn't one thing, but it is, well, I categorize it in five big categories. I'm sure there are other types of inflammation, but these are the big ones. There's classic inflammation, and that is the inflammation that we talk about when we think of the muscle aches and the joint pain that you get when you're having a fever, or when you've overexerted yourself. That is mediated by classic inflammation. We also know that histamine mediated inflammation is a really big factor in both chronic fatigue and in long COVID. And one of the things that really helped me is when I read articles about how long COVID activates mast cells. And mast cells produce histamine and activate this whole histamine mediated pathway. And in my work before COVID, in my work with chronic fatigue patients, once I started checking histamine, I was astounded how many people had elevated plasma histamine levels and how important it was for the brain and cognitive symptoms as well. So that's type 2 of inflammation. And then the third type of inflammation is GI mediated inflammation. So problems in the gut, inflammation in the gut is a huge contributor to whole body inflammation and brain inflammation, because the gut and the brain are connected by, they're hardwired into each other by a vast collection of neurons. A fourth cause of inflammation is autoimmunity. People with autoimmunity tend to get worse COVID and more long COVID. And in fact, people who have autoimmune illnesses, uh, they may be perfectly controlled. I have seen their autoimmune disease flare about a month after recovering from COVID, and that's a big pathway. And then there's neuroinflammation. So that is the fifth and final pathway of inflammation with a big I.
Thank you so much for describing all the different ways that COVID affects our body. Just to summarize for the listeners, it sounds like there are 5 types of inflammation, most notably kind of full body inflammation and then the neuroinflammation, as well as toxin overload and then nutritional deficits. Specifically, we talked about vitamin D, and I know later on you'll talk about some other nutritional deficits that are important. And I think we'd love to know, as I mentioned, kind of my story with post viral chronic fatigue syndrome. What is the relationship and how do you distinguish between long COVID and these other more chronic fatigue syndromes from other viruses such as EBV?
Yeah, so we think that a lot of chronic fatigue syndromes are post-viral syndromes, like from EBV, or maybe from perhaps not viruses, but other infections like Lyme or Borrelia. But uh, what I have noticed is there is a lot of overlap. The main distinction, at least in my experience, is that overwhelmingly people with chronic fatigue syndrome have gut inflammation, and they have dysbiotic flora, which means they have pathogenic bacteria or yeast or other sort of infectious species in the gut that are contributing to GI inflammation. Not so much in long COVID. I have one patient that I ended up doing a microbiome analysis, and everybody else improved on the protocol, and he ended up having candida. But that I would say is the exception. Everybody else seemed to improve on just the supplements. So I haven't had to do a lot of GI workups in COVID long haulers. I do know that it is possible to have viral reactivation like EBV and CMV affecting the gut in COVID long haulers, but I just don't think it's common.
So less distinguishing, a little bit of a distinguishing feature of other post-viral or post-infectious chronic fatigue syndromes versus long COVID is that GI symptom complex, right? Is that so that if you're having a lot of GI symptoms, nausea, diarrhea, vomiting, GI upset symptoms, it's a little less likely that that would be long COVID than it would be some other post-inflammatory, post-infectious cause. Is that correct?
Well, with my interviews with chronic fatigue patients, I always ask them about digestion and elimination, and most of them have issues.
Mm-hmm.
With my COVID long haulers, most of them have normal bowel movements. But of
Mm-hmm.
course, if they say, ever since I have COVID, I've been having loose bowel movements, then I have a very low threshold to work that up, because it can happen. I haven't needed to do, I have not, let's go back.
Mm-hmm.
I have not needed to do a big GI workup in COVID long haulers for that
Okay.
reason.
That's very helpful. Thank you for that. And Dr. Kwan, in your book, you talk about some of the screening blood tests that you get on all your patients that are concerned about long COVID. And as you said, not everybody has either a primary care doctor that's well versed in it, nor can they get to an integrative physician like yourself. And so your book is very useful. Could you, just for the purpose of our podcast listeners, could you review what a little summary of the diagnostic workup that patients should ask of their doctors, and if there are any doctors listening that they should be prepared to do for their patients that have symptoms of long COVID?
Yeah, so there are some very basic things that primary care doctors can order for their patients to check for nutrient deficits.
Mm-hmm.
So for inflammation, there are two tests that I like to recommend primarily. One of them is a high sensitivity C-reactive protein. And that is a good marker for that first inflammatory pathway, the classical inflammation. People who are classically inflamed tend to have a high CRP. And that is an indirect marker of something called interleukin 6, which activates that first pathway of classic inflammation. And then I like to have patients or doctors uh, request a plasma histamine level, because that's a huge pathway in both chronic fatigue syndrome and in uh, the mast cell activation that happens in long COVID. And along the lines of mast cell activation, a plasma tryptase level. These are easy labs that are available at UCSF, LabCorp, or Quest. They are not specialty labs. One thing about the plasma histamine and the tryptase is I do ask my patients to withhold antihistamines for 3 days before the test, because they can block the effectiveness of the testing and make it look normal. And that includes Pepcid and omeprazole. They are histamine blockers. They have, so that's important to know to get a good test. And with the caveat that it's very hard to capture histamine and tryptase. There's a lot of things that the lab has to do, like freeze the samples immediately and handle them correctly. And so a positive test is more helpful than a negative one, and take it with a grain of salt. But you'd be surprised how many people actually have abnormal levels once you start checking them. And then, of course, because nutrients are so important, and then nutrient deficits are important to diagnose. And so riboflavin, which is vitamin B2, vitamin D, ferritin, which is a really good marker for iron stores, and that's very important in chronic fatigue syndrome and also in getting rid of plasma histamine. Your body needs iron. And then I also recommend a zinc and copper level. These are all easy tests that can be checked by most primary care physicians for their patients. Mm-hmm.
So I'm reviewing in my mind the 4 buckets, because this is so important for me to try to learn this as a primary care doctor. The 4 buckets: for the inflammation bucket, the high sensitivity CRP, plasma histamine level, tryptase level are the 3 major ones. And then for the nutrient bucket, riboflavin, vitamin D, ferritin, zinc, and copper. I can remember that. Is there anything else you order that would go for the other 2 buckets, the toxins bucket and the neuroinflammation bucket, or are those the main labs that you would
Yeah,
start off with?
there is a test that is not available at UCSF or at LabCorp. Only Quest has it, and not every Quest lab has it. My understanding is the only one in the Bay Area is in Berkeley, that can check for glutathione status, and it is something called TGF beta. And so that one's I did not recommend universally because it's not easy to get, but that is a very good marker of glutathione stores. And I believe Quest actually can check glutathione reserves as well, but unfortunately not UCSF. Mm-hmm.
Thank you so
Thank
much
you.
for summarizing all of the lab tests that patients can advocate for to their primary care doctors, especially for primary care doctors who maybe aren't as well versed in treating and identifying COVID and long COVID. I would a lot of patients who have risk factors and who end up becoming diagnosed with COVID-19 are treated with Paxlovid. Is there a role in Paxlovid being able to prevent or treat long COVID?
Yeah, so there are studies currently ongoing, one of them at UCSF through the LINK trials, and in multiple other universities and hospitals on Paxlovid to treat long COVID. The theory for that is we observed that patients who had the COVID vaccine would oftentimes benefit and their long COVID would disappear. And so the thought was, is there failure to completely clear the virus from the body? And there are studies that seem to be preliminarily showing that even after COVID is gone, sometimes there are pieces of the virus that might still be deposited in tissues. And of course, now your immune system is highly reactive to it. And so it promotes this ongoing immune stimulation. Even though you're not actively infected, the viral particles are still causing symptoms. So we don't know what the trials will show. I believe that a subset of patients will benefit from long-term Paxlovid. I don't know if it will be FDA approved yet. It's too early to tell. But I think there's some promising research that will guide whether or not that is the case in the future. I don't think it will help everyone. I think it will help that subset of patients who maybe do still have persistence of some viral particles. I don't think it's the only cause of long COVID.
And a lot of people currently who are that I know, actually, some patients and some friends and family have gotten acute COVID, have gotten somewhat sick recently, but have gotten better on their own pretty quickly. And so they declined to go ahead and start Paxlovid for fear of side effects, for fear of everybody has heard about the metallic taste in the mouth, which is transient. But so some people have taken a little longer, some people have taken less time, but there are many that have decided not to take it. And it's still a question about, if you did take it, you might have a lesser chance of getting long COVID. But as you said, the jury's still out. We don't know that to be sure yet, although kind of does make sense on an intuitive level about how it seems to work. Yeah.
It sure
The
does.
persistent inflammation. Yeah. I think I would take it if I got COVID. What about you?
Oh yeah,
You'd be
anything.
inclined.
Absolutely, I
Yeah,
would.
yeah, yeah.
Yeah.
And Dr. Kuon, just to speak about hope, you mentioned that in the beginning you had gone through your own chronic fatigue syndrome years ago, and you have a lot of empathy for what it is that your patients are going through, and you are able to express understanding and hope. And part of the hope is not only being diagnosed with it and being under the care of somebody as thoughtful and kind and capable as you, but also that you have supplements, you have some treatment plans that actually could be very effective for helping. Could you talk about that? You do talk about that in your book. Could you summarize that for us, for our listeners?
For treatment of chronic fatigue syndrome?
Of long COVID, chronic fatigue due to long COVID and long
Oh,
COVID symptoms. Yeah.
yes, absolutely. So I came up with a diet and supplement protocol for treating long COVID, and I guide patients on how to maybe self-diagnose and figure out which protocol applies best for them. So there is a little bit of personalization, but generally, you want to follow an anti-inflammatory diet. And it's not a diet in terms of you're trying to lose weight and limiting calories. It's avoiding foods that are inflammatory and mindfully incorporating foods that help lower inflammation in the body. There are many plants like the cruciferous family that we talked about in our last podcast that have really dramatic anti-inflammatory properties, the fish oils. And so my book does start with describing the anti-inflammatory diet first, because that is very important. For people who have autoimmune illness, I do recommend elimination of lectins. And lectins are usually foods in the legume family that are really inflammatory to someone who has an autoimmune condition. And that includes things like gluten and soy. Um, and once they start an anti inflammatory diet, I recommend a supplement protocol that covers the basis of the most common inflammatory pathways. So it sort of addresses all the buckets. So for classic inflammation, uh, fish oil, vitamin D, zinc are all really important, and vitamin C as well. For histamine mediated inflammation, quercetin is essential. Bromelain is a very important antihistamine and a mast cell inhibitor. It also has antifibrinolytic properties, which is really nice because that's one of the things we talk about with long COVID is fibrosis and clots. So it covers those bases. And then the combination of quercetin, bromelain, and vitamin C is a powerful one for histamine mediated inflammation. I also talk about antioxidants, and antioxidants like either glutathione or NAC, which is a glutathione precursor in high doses, are important for addressing the bucket of fatigue that is too many toxins in the body. And then, of course, I talk about some mind body exercises to decrease stress, to address neuroinflammation, and how that tends to potentiate itself by creating a stress physiology on the body. And then the stress physiology maintains a high level of inflammation. And so it's important to do breathing techniques to make sure that you're taking melatonin to sleep well, and to undergo some exercises, which I call vagal toning exercises, make the vagus nerve, which is anti-inflammatory, stronger. There's evidence after COVID, the vagus nerve becomes weaker. And so it's important to rehabilitate the vagus, if you will, after getting COVID. So the combination of diet, supplements, and vagal toning techniques can be incredibly powerful for both chronic fatigue syndrome as well as for long COVID.
Excellent. Thank you so much for that. I have not heard of vagal nerve exercises before, so that's definitely a new one for me. Are there any other treatments that you would recommend for both chronic fatigue syndrome or myalgic encephalomyelitis or CFS, which is what we discussed earlier, as well as long COVID?
I think one of the important things to know about both CFS and long COVID is that a lot of people re-inflame themselves by pushing themselves too hard on the exercise activity front. So I have a very careful POTS, CHOPS criteria on how to very, very slowly incorporate exercise. Exercise does cause inflammation in the body. And in a normal state, that is a good thing because it promotes regeneration of muscles and tissues and increase cardiovascular strength. But when you're already inflamed, it can actually set you back on your recovery. And so one of the important things with exercise is to remember pacing. In fact, I recommend pacing throughout the day during recovery, which means if you cook and clean the house, you want to incorporate 30 minutes of rest afterwards. One of the problems people get into is they keep pushing themselves past the fatigue and then they don't recover. So pacing is very important for exercise. And going back to the vagus, there are several studies that show that vagal toning techniques, and that includes things like breath work, breathing techniques, singing stimulates the vagus. But if you don't have a good voice, breathing techniques are easier. And other techniques can be important for vagal toning. There are some studies on transvagal nerve stimulation, which is almost like electroacupuncture on the vagus, that have been found to be incredible for resolving chronic fatigue and long COVID. So it does point to the importance of vagal rehabilitation in the recovery process.
I just have to ask you again a little bit more about it because I have never heard of vagal rehabilitation. This is completely new to me. So other than singing, I'm imagining some things. Could you tell us as a resource, how can people learn more about it? Are there YouTube videos or is it in your book? I hadn't come across it yet. How do we come
Yeah,
across learning
towards the
about vagal?
end of the book, I can talk a little bit more about the vagus. The vagus is cranial nerve 10, and it is very important in regulating the autonomic nervous system. So fight or flight on one hand, and the rest, fed, relaxed state on the other side. There's evidence that COVID decreases vagal tone and makes the vagus weaker. And the stronger the vagus is, the more of an anti-inflammatory effect it has on the general body, because the vagus also connects to our lungs, our heart, and pretty much most of our organs. And so they are regulated by the vagus as well. Very, very important nerve. So the vagus has anti-inflammatory effects on all of these organs, and when it is weakened, it generates systemic and organ inflammation. So the vagus, because it has outflow tracts in the larynx, in the voice box, in the lungs through stretch receptors, in the diaphragm, and in the bowels, these stretch receptors can be used to your advantage. When you take a deep diaphragmatic chest breath and you are stretching your lungs and you're stretching your diaphragm, you're basically activating the vagus stretch receptors, and you're sending signals directly to the center of your brain that is saying, stop fight or flight, activate the safe, rested, fed response. And the more you do that, it's a little bit like a little Pilates pump, for your vagus. The more you do that twice a day, 3 times a day, the vagus gets stronger. And so that is a very easy way to rehabilitate the vagus. So most of us think that, we need to strengthen our muscles after you've been bedbound for a week. You also want to think about strengthening your vagus too.
That's fascinating. Thank you so much for explaining it that way. I'm really intrigued, and I can see how that has applications kind of for everything in our very stressful lives, which promote promote inflammation every day because of all the stress we have in our lives. So the idea that we take a break and take deep breaths, there's actual science behind that as related to the vagus nerve, and I'm very fascinated by that. I'm grateful that you explained that, and how that could really help chronic inflammation conditions like long COVID. For people who don't have doctors that are very well versed in chronic fatigue and in long COVID, do you have any recommendations about any referrals or specialists that they might ask their doctors to give to them?
Yeah, so most doctors who practice integrative medicine are well versed in chronic fatigue syndrome. However, one of my reasons for writing this book is doctors who specialize in integrative medicine often are very difficult to get access to. So, for example, my clinic is closed to new patients currently because of just overwhelming demand, and I'm one person. Other doctors have a private practice and it's cash pay, and there aren't integrative doctors everywhere. So most integrative medicine doctors may be unaffordable or just not available because the ones who do take insurance end up having overwhelm of patients flooding in the gates. So part of the motivation for writing the book is there are so many things you can do without needing a specialist or a specialist referral. Then I wanted to give power back to patients so that they can take charge of their health, and give them easy to explain protocols that they can follow at home with the help of their primary care physician or even on their own if need be. So yes, you can refer to a integrative medicine doctor, but that may not be the best or most accessible option for most people. And can I correct something about vagus and just add something to that? There is a very easy breath technique called the 4-7-8 breath. And if you Google the 4-7-8 breath by Dr. Andrew Weil, there's a really nice 3-minute video that people can watch that teaches them how to do the 4-7-8 breath. And that's what I recommend for all of my patients is this video.
Thank you so much for hold on, this is going to be out of order, so let me
Sorry about
No,
that.
no, 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 you're fine, you're fine, you're
I
fine.
keep thinking of things that I should have said.
No, it's wonderful, and that is a wonderful technique. I learned that from Dr. Weil also in the fellowship. It's real, and I use it a lot. So that is vagal rehabilitation. Thank you.
That is a vagal toning technique. Yes.
Yeah.
Well, thank you so much for explaining how people who don't have access to integrative medicine physicians or their primary care doctor doesn't feel comfortable with long COVID, how really they can advocate for themselves and try to find those resources and can come up with, hey, you know what, you don't feel comfortable with treating or diagnosing long COVID, but here's a list of tests that I would like you to run, and they can get your book for supplements and different options for treating long COVID. So thank you so much for spreading that information. What are the major impediments to researching, diagnosing, and treating long COVID that you've come across?
Yeah, the first one we talked about a little bit is the lack of consensus around the diagnosis. The CDC lists 4 weeks of persistence after COVID recovery. The WHO lists 3 months. It would be nice to have a unifying diagnosis so that we know how to study it better. The other problem is in the past, there has not been a lot of money or interest in researching chronic fatigue syndrome. Fortunately, COVID has changed all of that. There are so many people suffering from long haul, and there's so much disability that now it is not thought of as a rare disease, but it is, 1 in 3 people who get COVID are getting long haul. And finally, there is some NIH funds that are going to research of this syndrome. And I do anticipate that that barrier is no longer a big barrier. There is a silver lining, I suppose, to every tragedy. And even though so many people have died and suffered from COVID-19, it has fostered, I think, a new age in research on chronic fatigue syndrome through interest in researching long COVID. So the problem number two, which was lack of interest and lack of funding, I believe that that has gotten a lot better.
And Dr. Kwan, I just want to clarify something. You said, I just want to make sure I understand correctly. You said 1 in 3 people who get COVID will get long COVID. Is it that many? I thought it was more like 1 in 10. But
You
correct
know,
me, please.
it depends on what research you look at. The research I looked at did say that up to 30% of people who get COVID will have long haul. And of course, it's a moving target.
Yeah.
I wrote the book in September, and we are now in May of 2023. Those statistics may change depending on the shifts and waves in what we're actually seeing during the pandemic. So when I wrote the book, the evidence pointed to 1 in 3, but it may be lower now.
Wow. Okay. Thank you. Yeah, and I again, it also is a moving target because we don't know how we're classifying it in terms of, as you said, which definition are we using and what symptom complex are we using and how many people are misdiagnosed as something else. I think it would be a very difficult one for sure to quantify.
Mm-hmm.
What do you see for the future of long COVID?
Yeah. So as you mentioned with Bob's quotes, that I think now that there is more herd immunity through either vaccination or having been exposed to COVID, there is going to be less hospitalizations and deaths from COVID, but probably as people get it a second and third time, possibly an increase in long COVID. And so I think that the mortality will go down, but the long COVID cases and chronic fatigue syndromes will, those diagnoses will start going up. And so I hope that this book is a good resource for those who may be encountering challenges due to that.
Thank you so much for describing the future and just kind of circling back around. I think we talked a little bit about this, but if I am recovering from COVID, it's been 4 weeks. And what are the symptoms specifically that I should be looking out for? And in your experience, having treated many patients with long COVID, what are kind of the range in terms of what's a mild, long COVID case versus what is more extreme long COVID case, and what can people expect?
Mild long COVID case could cause some impairment in daily functioning where there is more fatigue and perhaps decreased cognitive ability, maybe slowing down of memory or some brain fog. But more severe long haul cases can be quite disabling, and I have a lot of patients who were initially on short-term disability who had to go on long-term disability due to it. So it can be quite devastating when it is severe. But other than the chronic and most common symptoms of fatigue, post-exertional malaise, and cognitive symptoms, the variety of long COVID symptoms are so uh, variable, much more so, I think, than the kind of symptoms that you get from other post viral syndromes. COVID is very good at kicking off all sorts of inflammation in the body. And I think that it affects more organs than other chronic fatigue syndromes. There are people who have recurrent myocarditis, for example, or clots. So it seems to be a little bit more heterogeneous in how it can affect more organs. But the three universally common ones are cognitive symptoms and chronic fatigue and post exertional malaise. But it can cause many, many other symptoms.
Thank you so much for going through that. I think it's helpful to think about the big buckets. And I'm sure the fact that I think we were talking earlier, long COVID is like a fingerprint. Everyone experiences the symptoms a little bit differently. And I can imagine that because it is a little bit, it can affect so many more organs than other post viral syndromes. A lot of primary care providers who are having patients and having different people experience different symptoms, it's hard to nail down and get that diagnosis.
Mm-hmm. I
And
think if you understand the basic pathways of inflammation and sort of like peel the layers of the onion, you will get to the core of what's going on.
I love that. Thank you so much. And as we wrap up the podcast today, I have a two-part question. First, what advice do you have to healthcare workers and the public who are experiencing chronic fatigue syndrome from long COVID? And second, what advice do you have for the healthcare workers who are treating those patients?
For both of those, I would first recommend the low hanging fruit, which is have your nutrients checked. Make sure you have enough vitamin D. Make sure your iron stores are not low. Make sure that you know if you are inflamed, and that if so, that you are taking nutrients to decrease that inflammation, like your fish oil omegas and your vitamin D. And my book outlines very clear markers that you can ask your PCP to check for you. For women, iron deficiency is so common and it is so underdiagnosed. And even when the ferritin is low, oftentimes it gets ignored. And so really important for women to stay on top of their iron, especially women who are vegan. Universally, those patients are low in iron. And then for those who are treating chronic fatigue syndrome and long COVID, please read the book. I try to make it very simple to break down what is considered to be a mysterious illness into simple elements that can be addressed one by one. But basically, start with nutrients, address toxins, ask yourself what kinds of inflammation are active in these patients. Do they have an autoimmune disease? Should I check for an autoimmune disease? If they have hypothyroidism, do I need to be checking TPO antibodies for Hashimoto's? And do they have neuroinflammation? You know, are they having insomnia and cognitive deficits? Do I need to teach them how to do a breath technique? You know, or look at the 5 types of inflammation for physicians. If you look at a chronic fatigue patient or a long hauler and you think about those 5 buckets, it should really help you figure out what you need to do next. And there are definite steps that you can take for each bucket to address it.
Thank you.
And there is a lot of hope if we can follow those and just think about it rationally. I just would like to repeat, Dr. Carla Kuon, your book is called The Long COVID Solution, a holistic integrative approach to post-viral recovery. And it is really an excellent book. And I got it on Amazon the other day, and I'm really happy that I have it. I'm inching my way through it, and I'm taking notes voraciously. So thank you so much. I do wish that you had a handout, and maybe that's coming up. I hope sometime soon, but I hope there could be just a very short abbreviated version that we could put in our coat pockets as a handout, as a reminder, as we often need. Is that something that is on the way, Dr. Kuon?
You know, that is a really excellent suggestion. I was thinking about creating a PDF and putting it on my website. What I have is in the ebook version, I have in the appendix a lot of handouts and links to handouts. But what I could do is sort of create a PDF of my appendix and post it somewhere. So I'm working on the Spanish and Portuguese version of my book right now, but that's definitely something I can work on as well.
That's wonderful. Thank you so much for being here and talking with us, Dr. Kuon. We really learned a lot from you.
It's been lovely seeing you both again, and thank you for having me on your excellent podcast.
Thank you so much.